think you have insurance, if you think that out-of-pocket cost is going to be too high, you're going to swallow those symptoms. You're going to sit back and say, maybe it'll get better tomorrow. Take a Tylenol. And by the time you actually come in, it might be too late.
All new here at 5:30, a U of L physician telling us those proposed federal cuts to Medicaid could hurt Kentucky's hospitals and their patients. Dr. Edward Miller talking about the federal budget bill supported by President Donald Trump that's making its way through Congress. And our Isaiah Kim Martinez has been following this story for us right now here tonight.
Isaiah, why did the doctor feel it was time to speak out?
Well, Connie, we do know that mega bill right now in Congress is not a final product by any means, right? It still has a ways to go, but Dr. Miller says he and other physicians have long seen the writing on the wall. In his words, it means more pressure on patients and hospitals, but one powerful Republican here in Kentucky says much of this outrage, in his words, is premature.
They have to choose. Do they feed their baby or do they take their insulin? It's a choice that they shouldn't have to make.
That's an impossible decision.
It's an impossible decision. There's a helplessness with these cuts.
Dr. Edward Miller says proposed changes and cuts to Medicaid on the federal level will only make an already sick Kentucky sicker.
They would likely have less access to regular routine prenatal care.
He's a Louisville obstetrician with U of L Health, working with high-risk pregnant women.
They would seek care later. They would have an increased risk of preterm birth, preterm delivery, and suboptimal outcomes.
The mega bill in D.C. to add mandatory work requirements to be Medicaid eligible is estimated to slash billions in federal funding if passed, what some Republicans see as necessary savings. Kentucky Senate President Robert Stivers talking to me in Louisville.
There's jobs out there, and I believe it's very well received when you say people who are capable of working should be working.
This year, Kentucky's legislature passed its own Medicaid work requirement law. Officials with Kentucky's Medicaid Services Department this week told lawmakers federal cuts could be detrimental to their $20 billion total budget, $15 billion of those dollars coming from the federal government. Both the governor and lieutenant governor this week have said this version of the House's budget bill, pushed by President Trump, would force rural hospitals to close.
When rural hospitals close, it will be the women who bear the brunt of it.
Miller agrees.
What we see and what we've seen, and we learned this from COVID, is that rural hospitals are already operating on a razor-thin margin, and that's only going to tip them over.
But Stivers pushing back on these claims, calling them premature.
Who represents one of the most rural areas in the United States that you're currently talking to? You. Me. And I have yet to hear from those hospitals in those areas complain about this.
Stivers went on to say that's his rebuttal. He also tells me he was in Washington, D.C. this week talking to Kentucky Congressman Brett Guthrie. He is the architect of these Medicaid changes. Stivers said Guthrie told him these federal cuts will not add a burden to Kentucky's budget. Remember, though, Kentucky receives more than 70% of its Medicaid dollars from the federal government. Doug.